borders anytime soon to prevent the spread of COVID-19. Bermuda reports a total of 98 confirmed coronavirus cases after recording 12 new positive on Tuesday. And Iran has successfully launched the country's first military satellite. Welcome to Telesur. I'm Carla Gonzalez in Quito, and this is from the South. Trinidad and Tobago does not intend to open its borders anytime soon. The Minister of National Security said this was to prevent the importation of second and third waves of the COVID-19.
Our medical experts have advised that this measure is a necessary measure, and we will continue to keep our borders closed. Second waves. Persons who are observing what is going on, as we in the government are around the world, will note that anyone who started to relax their border control and allow persons to free flow or even restricted flow across the borders to certain categories, for example, their nationals, immediately began to experience a second wave that can be worse than the first wave of infection from COVID-19. The Minister of Health referred to a few moments ago. Singapore, one of the points of everyone looking at a few weeks ago, started to ease on their restrictions with their border control. Immediately a second wave hit them. Japan, states of emergency across their country, unfortunately, again because of the easing of restrictions. South Korea, and there are a number of other jurisdictions. Bearing all of that in mind, after consulting with our medical experts, we have no intention at this stage to allow our borders to become porous and allow persons a free flow of access.
Bermuda has a total of 98 confirmed COVID-19 cases after recording 12 new positives on Tuesday. Of those new cases, 11 were imported, with ages ranging from 18 to 91 years. Thus far, 38 patients have recovered from the illness, while 10 remain hospitalized. According to the government, 44 people are either at home or in quarantine, and the death toll remains at 5. In Argentina, at least 12 elderly people have been evacuated from a Buenos Aires nursing home after various staff members and residents tested positive for COVID-19. Authorities say at least 6 elderly residents and 1 nurse have tested positive for the virus so far, but they are still waiting for the test results of the rest of the residents and personnel. As of Wednesday, Argentina registers more than 3,100 cases and 152 deaths.
We managed to get them all transferred because they had no medical assistance here. 72 hours ago, they were absolutely abandoned. We do not know in what situation they actually left, what type of medication they had, how they are.
In regards to isolating them, it's difficult because it's necessary to isolate each one in one room. And it's not possible because if I have more patients than rooms while strictly complying with the building protocol, we can't. It's a factual impossibility. This situation was revealed to the Buenos Aires city government. But above all, the point was the lack of staff members. The nurses were infected. We were desperate.
Health authorities in Brazil carried out the first trial run of mass testing for COVID-19 in Brasilia. The plan is to carry out 100,000 rapid tests until Friday, the equivalent of 3.3% of the population of Brasilia, a city of 3 million people. This process takes just minutes and can be done without people exiting their cars.
We're going to start with 100,000 tests, which is around 5% of the population of the federal district, but we will test up to 15%. The idea is to do 450,000 tests, which give us a lot of security regarding any measure and any decision we intend to take over this period.
In addition to being from a risk area, I'm a senior. My wife works in the health sector. She works frequently. She is a nurse. There is a risk that she brings the virus home. We have a pregnant woman at home. We really need to be careful to avoid transmitting it to others.
Intensive care units across 3 Brazilian states are now operating at full capacity due to the coronavirus pandemic. Our correspondent, Brian Meir, has the details.
Last week, health authorities in Amazonas, which is the Brazilian state with the highest number of per capita coronavirus patients, announced that their ICU units in the public hospital system were overflowing. And from that point on, anyone who needed to get on to a respirator had to wait for someone either to recover from coronavirus or die, who was in the ICU ward. Now, 2 more Brazilian states have announced that they're in the same situation. Ceará and Pernambuco, which are 2 states in the impoverished Northeast, have both announced that their ICU wards are completely full due to the coronavirus outbreak. Now, Brazil has 26 states, plus the federal district of Brasilia, and each one has their own public health system. They have a lot of autonomy on how to use their resources that come from the federal government every year. But the fact of the matter is, although some states are doing much better, the numbers keep increasing. Last week in São Paulo, which is the state that's hardest hit in the total numbers of coronavirus patients, announced that their ICU wards were 70% full. And only a week has passed and the number's already gone up to 80%.
That was Brian Muir from Brazil. The head of the UN's World Food Program is warning that as the world is dealing with the pandemic, it is also on the brink of a hunger pandemic. Adding that even before COVID-19 became a global issue, the WFP had warned world leaders that 2020 would see the worst humanitarian crisis since World War II.
This might sound truly shocking, but let me give you just some numbers. 821 million people go to bed hungry every night all over the world, chronically hungry. And as Dr. Chu just pointed out, as the new global report on food crisis that's published today shows, there are a further 135 million people facing crisis levels of hunger or worse. That means 135 million people on Earth are marching toward the brink of starvation. But now the World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020. That's a total of 265 million people. In a worst case scenario, we could be looking at famine in about 36 countries. And in fact, 10 of these countries, we already have more than 1 million people per country who are on the verge of starvation.
And the agriculture ministers of the G20 countries held a virtual meeting and pledged to ensure sufficient global food supplies amid the pandemic. The ministers said we will work together to help ensure that sufficient, safe, affordable and nutritious food continues to be available and accessible to all people, including the poorest, the most vulnerable and displaced people. They also said it was important that coronavirus restrictions do not create unnecessary barriers to trade and food supply chains. We're taking a short break now. Don't go away. Welcome back. More news at this hour. Mexico's Deputy Health Minister Hugo López-Gatell says the country has entered phase 3 of its containment efforts to control the COVID-19.
Today we want to declare the beginning of phase 3 of the COVID epidemic, keeping in mind we are in the phase of rapid ascent where there will be a great number of cases of contagions, of hospitalizations, but that we must continue to maintain the national path of healthy distance so that these are kept to the minimum possible.
Meanwhile, doctors and nurses across public hospitals in Mexico have continued to protest for protective equipment. The healthcare workers blocked the entrance of the Institute for Social Security in Mexico City. They also expressed concern over the rising numbers of medical staff infected with the new coronavirus. The Mexican government has approved an amnesty law paving the way for the release of first-time non-violent offenders to lower the risk of coronavirus outbreaks in the prisons in the country. The government says the bill could benefit about 2,600 inmates in the federal prison system. The bill would include those convicted of less serious offenses like non-violent robbery or small-scale drug possession if the culprit was poor, forced into the act, or if they had a disability. Inmates who are indigenous will also be freed if they weren't guaranteed a fully fair process. The bill also provides amnesty for those convicted of abortion. And with social distancing measures in Mexico, people are choosing to buy their groceries in neighborhood stores rather than big supermarkets. Let's take a look.
In Mexico, neighborhood stores have become the safer choice for most.
They come more often, they don't take too long, they leave quickly. This is the best for a small business like ours.
Known also as corner stores, during these weeks, they have become essential as most people avoid large supermarkets.
They take care of us quickly here. We don't like the supermarket because over there it's more likely to be infected.
They say it's safer because it's less likely to catch the virus here.
We know these people, so we feel safer in our own neighborhood.
It's estimated that in large cities, neighborhood stores supply close to 50% of a family's basic goods.
We are a basic sector of the economy. We offer necessary goods. Not everyone likes going to the supermarket. They feel safer here and are treated well. We know our customers and we like to treat them well.
They have remained open through thick and thin, be it during a hurricane, earthquake, drought, or even a pandemic. We can clearly see that despite the rise of supermarket chains and the arrival of many new competitors, neighborhood stores remain the most important distribution channel of basic goods for Mexico.
Panama City's metro has started to implement thermal cameras in stations to detect possible COVID-19 cases. The infrared cameras are installed at the entrance of the city's metro system and near the turnstiles. Authorities in charge say this is one of the ways in which public transport will forever be different across the world. Panama at the moment has the most infections for any country in Central America.
It is a thermal camera that has real-time video so that the operator can identify people with high temperatures and quickly follow a protocol.
The pandemic will change the way we move, the way mass transport works. Mass transport will change. Taking temperatures is one of the important measures, coordinated through the national government and the health ministry.
There is increasing concern over the situation in Colombian prisons, where at least 25 cases and 3 deaths have been confirmed.
A state of emergency declared on the prison system has yet to have any effect as protests by inmates continue.
In this jail, there's one worker who has been infected. We are highly concerned because our administration, in coordination with Valledupar Town Hall and the governorship of Cesar, have done nothing to mitigate the situation.
The first cases of COVID-19 were discovered in a Villavicencio jail in the Meta department. From then, the Picota, Bogota, and Florencia jails have also confirmed cases.
The decree by the government doesn't address the most elemental problem, which is death. The already confirmed deaths of prisoners. They are ignoring the reality of our prisons, like they are the reality of Colombian families.
Experts agree that the measures imposed by authorities came too late, and they do not address the demands of the prison system.
There were rumors and complaints of an infected prisoner in Villavicencio jail. This was made known over the social media. Then, on March 22, authorities decided to transfer prisoners to other jails without testing any of them. Today, we have 25 infected in Villavicencio jail and 3 dead, on top of other infections in other jails.
Authorities also announced a process to free prisoners or place them under house arrest, which could benefit 4,000 of them. It will take 2 to 3 months to be put into practice.
In other news, the South African government has unveiled a $26 billion relief package aimed at supporting the economy amid the COVID-19 pandemic.
We are announcing this evening a massive social and economic support package of 500 billion rand. Another significant area that requires massive additional expenditure is the relief of hunger and...
Joining us again. In the United Kingdom, the recently appointed Labour leader has slammed the government's slow response to the coronavirus. Keir Starmer said the ruling party has failed to increase testing, which is crucial to controlling the spread of the virus.
Testing is obviously crucial at every stage of the pandemic. But we have been very slow and we're way behind other European countries. Now, the Health Secretary made a very important commitment to 100,000 tests a day by the end of April. But yesterday, the figure for actual tests was 18,000 a day, and that was down from Monday, which was 19,000 tests a day. So we're way behind the curve, and the end of the month is a week tomorrow. So what does the First Secretary expect to happen in the next 8 days to get us from 18,000 tests a day to 100,000 tests a day?
Let's turn to our correspondent, Pablo Navarrete in London, for more on the situation in the UK.
The number of people that have died due to coronavirus in the UK could be as high as 41,000 people, according to an article published by the Financial Times today, Wednesday, in the UK. Now, the article has taken figures from the Office of National Statistics, which is the UK's leading provider of national statistics. It is tasked with carrying out the census in England and Wales every 10 years. It's taken the figure, which includes deaths from hospitals and outside hospitals. Now, the UK government latest figures for the deaths due to coronavirus are 17,337 as of yesterday, Tuesday. Now, these figures don't include hospital deaths. The new figure, which is more than double this figure, takes into account hospital deaths and looks at the recent trends in mortality. For example, on the week ending April 10th, it appeared that 75% more people died than would be expected. Now, this article comes in the context of increasing criticism of the Boris Johnson government's handling of the crisis. On Sunday, the Times, which is a normally pro-government or sympathetic to the government newspaper, published an article which suggested that Boris Johnson hadn't taken the threat of the coronavirus sufficiently seriously, had dealt with it in a rather complacent manner, and now with a high number of deaths in the UK, perhaps this complacency is being translated into the high death rate that we are seeing, making the UK one of the countries in the world with the highest per capita deaths due to coronavirus.
Pablo Navarrete from the UK. Activists have reacted to the announcement by U.S. President Donald Trump that he will sign an executive order to temporarily suspend immigration to the United States. He said this will protect U.S. jobs during COVID-19.
Well, once again, President Donald Trump is seeking to distract the nation with his tweet that attacks immigration and attacks immigrants. This is not an issue that should be brought up at this moment. This is a moment in which the President of the United States should be working with our governors and with our local elected officials to safeguard lives. In this moment, I think that we as Americans need to see this for what it is, which is a distraction, and it's just one more call to racism, division, and xenophobia.
There's no merit in any such planned executive order. It's been demonstrated time and again, immigrants are job creators. They're a net benefit to the economy. And, banning the immigration of any person to the United States except for agricultural workers, it's not going to solve the coronavirus pandemic. It's going to leave us with a shortage of healthcare providers, people that are involved in transportation, pharmacy, grocery. It puts us at a disadvantage. It's not going to help us out of the problem Trump's made in mismanaging this pandemic. It's a distraction.
Germany's capital, Berlin, has joined a wave of federal states that have ordered residents to wear protective masks on public transport effective April 27th. This comes as the country has started to relax some of its measures to stem the spread of COVID-19. Members of the public have started to slowly return to the streets as shops under 800 square meters have been permitted to reopen in most states. Meanwhile, Germany has cancelled Oktoberfest, the famous beer festival in southern Bavaria, over the coronavirus. The event was scheduled for September 19th to October 4th and was expected to draw some 6 million visitors. Japanese authorities have announced 34 crew members on an Italian cruise ship docked in Nagasaki have tested positive for coronavirus. The Costa Atlantica ship has been docked in the southern port of Nagasaki since January for maintenance. On Tuesday, one crew member was confirmed to have the virus. Officials said none of the 623 crew members have showed serious symptoms, and now they are being self-quarantined in single rooms. The death toll from the 14-hour shooting rampage that jolted Canada over the weekend has risen to 22. The victims include a 17-year-old pregnant healthcare worker and a veteran officer of the Royal Canadian Mounted Police. The 51-year-old male suspect was killed by law enforcement after he created 16 separate crime scenes in Nova Scotia. During the attack, he wore an authentic RCMP police uniform and drove what appeared to be a police vehicle.
This is fucking crazy.
Protests in Lebanon continue for the second day this week despite the coronavirus lockdown. Hundreds of demonstrators drove around Beirut in a show of rejection for the political leadership they blame for the country's economic and financial crisis. The protest coincides with a second day of parliamentary session where lawmakers are discussing the creation of an anti-corruption commission and legalizing the cultivation of cannabis for medical and industrial use.
We are here today protesting against the proposed general amnesty law that has a lot of defects. Lebanese legislators are trying to approve this law to protect themselves of the corruption that they are guilty of.
Buses in Nepal have begun taking workers from Kathmandu back to their villages after the Supreme Court ordered the government to take responsibility for getting workers home amid the COVID-19 pandemic. Since Nepal went into lockdown on March 24th, thousands of people in Kathmandu had been trying to return to their home districts as they were left without resources for food and shelter in the capital. When COVID-19 emerged, the Nepalese government was quick to close the Himalayas for the popular spring climbing season, which lasts from March to May. This meant an estimated $4.4 million loss, which the country earns for permits fees from people hoping to scale Mount Everest. Iran has announced it successfully launched the country's first military satellite. It is the first time the Islamic Revolutionary Guard Corps took credit for the launch of a military satellite, and it takes place after several failed launches in recent months. Wednesday's launch comes amid tensions between Iran and the United States over its collapsing nuclear deal, and after a U.S. drone attack in Iraq killed Iranian top general Qasem Soleimani in January. And with that, we end our news brief. But you can find these and many other stories by checking our website, telesurenglish.net. And be sure to follow us on social media. For Telesur English, I'm Carla Gonzalez. Thank you for watching.